Whooping Cough by Angela Kersey. Whooping cough is a deadly bacterium caused by Bordetella. Highly infectious, bacteria is transmitted through small droplets released into the air when someone is infected when they cough or sneeze. Adult symptoms are mild, which include sneezing, runny nose, low-grade fever, fatigue, and cough. Other symptoms of whooping cough: runny nose, sneezing, low-grade fever, fatigue, mild cough, watery eyes, stuffy nose, dry or irritating cough, malaise, sore throat, occasional diarrhea, apnea, vomiting, and proximus. These symptoms are typical during the first week, which after that they become very serious. These are steps of whooping cough. First, patients are incredibly contagious in the primary stages of the disease that last typically 1 to 2 weeks. After some time, people develop a severe persistent cough that leaves them breathless. This typical whooping sound happens when people breathe in sharply to catch their breath after a coughing spell. The final stage of the cough, it progressively improves, and the coughing spasms occur less frequently. At this time, individuals are no longer transmittable, and they run the danger of developing other infections, which can deliberate down the recovery process. These are some key points to remember about whooping cough. It is caused by Bordetella bacterium. Children who are not vaccinated are 23 times likely to receive whooping cough. The bacterium is spread in minuscule droplets of sputum when the individual coughs or sneezes. Infants with whooping cough are usually admitted into the hospital for treatment. Not as severe in babies and children, but they are typically similar to symptoms of bronchitis. To prevent whooping cough, or some preventions of it, you can do some diagnostic testing. It's throat and nose cultures, blood tests, x-rays, making sure you cover your mouth, wash your hands frequently, hand sanitizer. Vaccines, the DTaP, or treatments, antibiotics, corticosteroids, oxygen, and over-the-counter cough medications. Advantages: significantly improved creativity and problem solving with the use of cross-functional crews because of their structure. Members of cross-functional crews come in an assortment of experience, expertise, and knowledge. This variety can help broaden perspectives and create synergy. Transformal leadership is a great style to use. These leaders encourage, inspire, and motivate employees to innovate and create. They're self-management, inspirational, adaptable, take risks, entertain new ideas. Coordinating committee, they're responsible for the occurrence needs, developing fast and aggressively. The endemic coordinating committee should make sure should guarantee the following activities are carried out. For example, intensifying surveillance and notification of suspected cases, laboratory confirmation of the outbreak. Steps in the endemic investigation: you want to determine if the outbreak exists. Implementation, immediate control measures. Proceed hypothesis explaining the introduction that is caused by the disease. Write a report. Develop long-term control. All of this will help our employees and practitioners attend to patients who require more care. As a private facility, we are working with our residents community to update them of an eruption and assure them that we are doing the best that we can to avoid all of the spread of the bacteria. Thank you.